The 5 French sheetless guiding catheter will come in a complete package with different parts. The catheter is manufactured by Medikit and is called Meito Masamune. On the external part of the packaging you will find informations. On the label onto the package you will find more informations about the diameter, in this case a 5 French, and the curve of the guiding, in this case a Judkins Wright 4. Moreover, you will have informations about the 3 different sets that you will find in the packaging: the guiding catheter, the dilator, and the puncture set. The guiding catheter is a 5 French and the outer diameter and its internal diameter is 0.059 inches. The guiding catheter is compatible with a 0.038 inch guide wire. The length of the guiding catheter is 100 cm and is hydrophilic coated for most of its length, 95 cm. The dilator instead has an external diameter of 1.5 mm, is 130 cm long, that means that it's longer than the guiding catheter, and will accept a guide wire of 0.025 inches, which is thinner than the usual guide wire. The puncture kit will comprise 3 different parts. First of all, a short dilator, 18 cm long, 5 French in diameter, an hydrophilic wire of 45 cm and a thickness of 0.025 inches, and a puncture needle with cannula of 22 gauge. When you open up the packaging, please take care not to kink the catheter, since it's a 5 French. Please also do not remove the parts from the support. At this point you can remove the whole parts together with the support from the packaging and offer it for sterile use. This is what you will find in the packaging. You will have a puncture needle with cannula. You will have a small scalpel to help you through the skin. You will have a short dilator to exchange wire. And you will have a short wire for the puncture. Here you see the guiding catheter in gray and the long dilator in blue. Before we will assemble the guiding catheter, I will show you in more details the puncture kit. Now I will describe you the puncture kit in more details. Please be careful when you remove the parts from the package in order not to damage them. First of all, you will use a needle with cannula. The needle is 22 gauge. The cannula is a few millimeters shorter than the needle. Secondly, you have a short wire, 45 centimeters long. You use it for the puncture. Since it's an hydrophilic wire, please be sure that you wet the wire properly. The wire is 0.025 inches and it has a J tip. On the wire, you will introduce a short dilator, 5 French in diameter, in order to exchange for a longer wire. In case you will have difficulties advancing the short dilator in the skin, you can take advantage of a small scalpel that will come with the packaging. After you have gained access to the radial artery and you have the short dilator in place, you will introduce a long 0.025 wire, which is not provided in the packaging, and you will remove the short dilator. At that time, you can introduce the sheetless guiding into the radial artery. Before you remove the guiding catheter and the long dilator from the packaging, please flush them with water. Then first remove the dilator from the packaging, just pulling it out of the packaging this way. Now you have the long dilator out of the packaging. At this point, you will take the long dilator and you will introduce it gently into the guiding catheter. Please do not remove the guiding from the packaging until the dilator is in its place, in order not to kink or damage the guiding catheter. At this point, you will fix the dilator onto the guiding catheter by gently screwing the dilator onto the guiding. At this point, the two are locked with each other. If you look on the other side, you will see at this moment the long dilator protruding for a few centimeters out of the tip of your guiding catheter. At this point, you can remove the guiding with the dilator within from the packaging. Now you can safely remove the guiding catheter from the packaging by gently pulling on its length. The guiding catheter is now ready to use. The guiding catheter is covered with an hydrophilic coating, so please do not wet the outside of the guiding catheter at this moment. You will do it later, at the moment you will advance it into the radial artery.